Before we start, I'd like to go over a few housekeeping items. As mentioned, today's call is being recorded and will be made available on the Cancer Support Community website, www.cancersupportcommunity.org/webinars. The format of today's webinar is as follows. Our presenters will be featured first, and then we will begin the question and answer portion. To ask a question, please type it in the Q&A box on the right. You may submit a question through the box at any time during the event. At the end of the webinar, you will be redirected to the post-event survey. Please complete the survey as your input is invaluable to us. The survey will only take a few minutes. It is now my pleasure to introduce our featured speakers, Joanna Morales and Melissa Wright. Joanna Morales is CEO of Triage Cancer. She is a cancer rights attorney, author, and speaker, and has spent more than 19 years working on behalf of individuals with cancer. Joanna received a Juris Doctor from Loyola Law School, Los Angeles, and received her undergraduate degree from UCLA. Melissa Wright is the Program Director for Gilda's Club Quad Cities. Melissa is a licensed master social worker and a certified oncology social worker who has been part of Gilda's Club Quad Cities since 1998. Melissa received her Master's of Social Work from the University of Iowa and received her undergraduate degree from St. Ambrose University. Melissa, I will now turn the presentation over to you.
Okay. Well, thank you, Ria. So first, let's get started with a little bit about the cancer support community. Backed by evidence that the best cancer care includes social and emotional support, CSC offers a menu of personalized services and education for patients and families affected by all types of cancer. In 2009, the wellness community and Gilda's Club worldwide joined forces to become the cancer support community. CSC provides the highest quality emotional and social support through a network of more than 50 local affiliates, 100 satellite locations, and online. So today's discussion, our webinar, Beyond Medicine Addressing the Emotional and Financial Concerns, will consist of these topics. We'll begin with financial concerns. Joanna will discuss the Affordable Care Act, Medicare, obtaining prescription medications. Then I will come back on and talk about the emotional concerns, such as your emotions, improving communication with the healthcare team, positivity and hope, and then we'll have questions and answers and closing remarks. So beginning with financial concerns. So I think we probably all know that the financial impact of having a cancer diagnosis can have a lot to do with how we cope emotionally with the situation. The financial concerns affect us through a variety of ways. We can feel stressed, we can feel anxious, frustration, as well as many other emotions, I'm sure. I wanted to mention that we get calls here at Gilda's Club, where I'm located at in Davenport, Iowa, almost every day from people inquiring about financial resources that are available. And I've heard many stories from the callers and our members and the support groups about how stressful it can be when faced with cancer. And it can definitely put a financial strain on the person with cancer as well as all of their family members. And this stress can influence the decisions, obviously, that they make about their treatment. Folks have told me that they can often be faced with having to make a decision about the month, which month they can refill a prescription. I've heard others say that they've had to max out credit cards to pay for the debt for their out-of-pocket expenses. And I really feel like this is a burden that a person with cancer and their families shouldn't have to face. So I'm hopeful that today we can discuss some of the options that are available and provide some resources for people who don't have insurance. And Joanna is now going to address some of the practical resources that are available. So I'm going to turn it over to her.
Thank you, Melissa. So certainly one of the biggest financial concerns is how to pay for medical care and the additional costs that come along with medical care. And the Patient Protection and Affordable Care Act does a few things to help with the concern of cost of care. And the Act is called a number of different things, so I want to make sure everyone's familiar with all the things that it's called, because there's a lot of confusion right now when people use different terms to refer to the law, but they all mean the same thing. So the Patient Protection and Affordable Care Act is the full name of the law, but people refer to it as the Affordable Care Act or the ACA or Obamacare or healthcare reform. So any of those things really refer to the same piece of legislation. And one of the first things that happened after the Affordable Care Act was signed into law way back on March 23rd of 2010 was the creation of healthcare.gov. So even though we're hearing in the news about all the challenges from this website, it's actually been an excellent resource for people to find information about their health insurance options and to learn about what's actually in the Affordable Care Act. And that really was the case up until October 1st when they rolled out the new capabilities of the website and ended up causing quite a few problems because different parts of the application process didn't talk to each other. And then certainly, since everyone was so interested in looking at all the information on the website, it caused a great deal of overloading of the website. So it's still pretty slow when you go onto it, but the information is there. So there are some consumer protections that are in the Affordable Care Act. And the reason that we really needed these consumer protections are that we were finding out that our health insurance coverage and our health care system wasn't working the way that it's supposed to, that our health insurance coverage wasn't adequate. And what I mean by that is that we know in the United States that 62% of all bankruptcies are based on medical debt. But 78% of those individuals actually had health insurance coverage. So if that many people were having health insurance coverage and still having to file bankruptcy because of their medical bills, then the system's not working like it should. And we want to make sure that you can actually rely on your insurance being there when you need it. So one of the things that the ACA did was prohibit insurance companies from canceling your policy when you try to use it. And that sounds like something that would never happen, but it was happening a lot, particularly when people had serious or chronic medical conditions and were very expensive for the insurance companies. And the insurance companies would try to find a reason to cancel your policy. And that's no longer the case. Under the ACA, insurance companies can't cancel your policy unless you commit fraud on your application or if you stop paying your premiums. So that way you can actually feel assured that your insurance is going to be there when you need it. The second thing that the ACA did was eliminate lifetime limits on your health insurance policies. So lifetime limits are a cap, a dollar cap, on how much you can use your policy, and then it ends. And lifetime limits were eliminated back in 2010, and annual limits have been phased out over the last 3 years, and beginning January 1st, annual limits aren't allowed on policies either. And then the ACA offers people free access to preventive care for most health insurance plans. And what I mean by free is that when you go and you get these specific preventive services, you don't pay a deductible, you don't pay a copay amount, and you don't pay a coinsurance amount. So it's entirely zero out-of-pocket cost to you. And it's a specific list of preventive services. So if you wanted to find that list, you could go to healthcare.gov and type in preventive services in the search box, and it will give you the full list of services that you can get free of charge. The ACA also wanted to expand access to health insurance coverage for different groups of people, and they focused on children and adolescents and young adults. And the way that they expanded coverage was by allowing young adults to stay on their parents' health insurance plan until they turn 26. And so previously, young adults would have to be a full-time student or be a dependent under IRS standards, and that's no longer the case. It's just based on age. So as long as the young adults under the age of 26, they can stay on their parents' plan, even if they're married, they will still have access. And then the Affordable Care Act actually said back in 2010 that insurance companies can't deny children who have pre-existing medical conditions. They have to provide coverage to those children. Now, there's also the Medicare, which is a federal health insurance plan. So there's Medicare and Medicaid, and I'll talk about Medicaid in just a minute. But Medicare is the federal health insurance plan specifically for U.S. citizens and some legal residents who are 65 and over. And then there's some additional categories, but in the cancer community, people often have access to Medicare because they are receiving Social Security disability insurance benefits for at least 2 years, and that's how they qualify for Medicare. So if you wanted information about the details of Medicare's benefits, you could go to medicare.gov. And the way that Medicare works is that there are 4 different parts of Medicare's coverage. The first part covers hospitalization. That's Part A. Part B covers just about everything else, except for Part D, which covers prescription drugs. Part C is actually called Medicare Advantage plans, and Medicare Advantage plans are actually Medicare managed care. So you would get access to the coverage from Part A, Part B, and Part D through a managed care plan. Now, if you decided that you didn't want a managed care plan and just had Part A, Part B, and Part D, that acts as fee-for-service Medicare. So you can go to any provider that accepts Medicare. But the way that a standard Medicare plan works is that it's an 80-20 plan, meaning that Medicare pays 80% of the expenses and you're responsible for 20%. That's your coinsurance amount. So some people decide that they want to buy Medigap supplement plans to Medicare, which often pick up that 20% of cost. But you have to buy those Medigap plans. They're not available for free. So the Affordable Care Act actually did a few things to improve Medicare benefits. They added a free annual wellness visit. They added free preventive services, the same way that they did for private health insurance coverage. But the Affordable Care Act also lowers the prescription drug costs for individuals who are on Medicare. And it reduces the amount that you pay for your prescription drugs each year. And so they decided to spread that out over a 10-year period. So it goes all the way up until 2020. But each year your costs would lower. So there are also some parts of the Affordable Care Act that haven't gone into effect yet, that actually start on January 1st of 2014. And certainly the most significant of those parts is the protection for individuals who have pre-existing medical conditions and that they can't be denied health insurance coverage starting January 1st. So what this means is that regardless of what your health history is or your health status, you can't be denied health insurance coverage. The Affordable Care Act also changes the way that insurance companies can charge you for your health insurance policy. So starting January 1st, insurance companies can only look at 4 things when they're deciding how much they're going to charge you for your monthly premium. They can look at whether or not you're buying a policy for an individual or family, because clearly if you're covering more people, you can be charged more. Your age, and they put a cap on how much more you can be charged based on your age. So it's a 3-to-1 ratio, which means that someone who's 64 can only be charged up to 3 times more than someone who's 21. So right now there's no cap at all. Your geographic location is also something that they can look at. So in different parts of the country, even in different counties, you can be charged different amounts for the health insurance plans that are available to you. And then the 4th thing is actually whether or not you use tobacco. So if you use tobacco, you can be charged more under the Affordable Care Act for your health insurance plan. However, some states have actually passed state laws that eliminate tobacco use as a factor. So California would be an example of that, D.C., Connecticut, and there's a few other states. So the Affordable Care Act also creates 2 two new ways to get access to health insurance coverage. The first way is by expanding Medicaid, and Medicaid is the second federal health insurance program. And the way that Medicaid currently works is that you have to have a low income level, a low asset level, and meet some other category of eligibility, meaning that you are a senior or you have a disability or you're pregnant. So you have to meet that other category. The Affordable Care Act actually creates a new category of eligibility for all adults who have household incomes up to 138% of the federal poverty level. So what that means is that if you're an individual and you make annually less than $15,856, you'll get access to Medicaid beginning January 1st. If you're a family of four, that amount is $32,499. So Medicaid, the expansion of Medicaid was originally mandatory under the law, but the Supreme Court changed that and made it voluntary for states. So many states are actually choosing not to expand access to coverage through their Medicaid programs. There's about 26 of them. So it's important for you to realize which state you're in and whether or not that's going to be available to you. The second way that the ACA provides a new option for health insurance coverage is through the creation of the state health insurance marketplaces. And these marketplaces are also referred to as exchanges, but really what they are is an insurance shopping mall. So it's one place that you go to find information about all of your health insurance options. And all of the plans that are sold through these marketplaces are standardized, which means that every insurance company offers plans at different levels of coverage. And the way that they've defined these levels of coverage are by the cost share. So there's 5 different levels of plans. 4 of them are named by metal level. So you have the platinum plan, which is the highest level of coverage, which has a cost share of 90-10, meaning that the insurance company pays for 90% of your medical expenses and you pay for 10%. And then it goes down by 10% to the bronze level plan, which is a 60-40 plan. So the plan covers 60% of your expenses and you pay 40%. There is a 5th level of plan called catastrophic coverage, and these plans are only going to be available to young adults under the age of 30 or for individuals who qualify for the financial hardship exception. And then if you decide that you want to buy a plan in the marketplace, you may actually qualify for financial assistance to buy that plan. And there's 2 types of financial assistance. The first is called a premium tax credit, and it lowers the amount that you would pay for the premium of your plan. So if you chose a plan that maybe had a $300 a month premium, and you qualified for a premium tax credit of $100, then you may only end up paying $200 a month for your monthly premium. So it can lower what you pay for your premiums. Whereas cost-sharing subsidies lowers the amount that you pay when you actually get medical care. So if you have a $25 copay for when you go into the doctor's office for an office visit, your cost-sharing subsidy might lower that amount to a $5 copay or a $3 copay. It can also lower your annual deductibles and your out-of-pocket maximums. But all the plans that are being sold in the marketplace have caps on how high those annual deductibles can be. So you'll never see a plan in the exchange that costs more than $2,000 for their annual deductible for an individual or $4,000 for a family. And for the out-of-pocket maximums, the highest it can go is $6,350 for an individual or $12,700 for a family. So it's important to understand your out-of-pocket maximums because that's the maximum amount of money that you're going to spend out of pocket for your health insurance expenses other than your premiums during the year. So it helps you actually plan how much you might have to pay for medical expenses during the year. It's a known figure. So I'm going to shift a little bit to talk specifically about the challenges and some of the resources for obtaining prescription medications and paying for them. So most health insurance policies include coverage for prescription drugs, and that benefit is usually managed by a company other than your insurance company. So you sometimes have a different prescription drug card than your regular medical card. And it's important that you follow the rules when you actually go and get your prescriptions, which means that you have to make decisions about which pharmacies that you go to. Do you order mail order drugs? And there's always a phone number on your insurance card that can tell you information about where you can go to pick up your prescription drugs, so that it's going to be covered by your insurance company and that you're not going to be stuck with 100% of the bill. And certainly anytime you're communicating with your insurance company, it's a good idea to keep notes. And then a formulary is a list of prescription drugs that are covered by your health insurance plan. And each health insurance plan has a different list of drugs that they cover. So whenever you're looking for a new health insurance plan, you want to check the formulary to make sure that any prescription drugs that you're taking are actually included on that list and are covered by your insurance company. Generally, if those prescription drugs are on the list, the formulary list, then you don't need any sort of pre-authorization to actually get your prescription filled. So you don't have to ask for permission first. And your physician doesn't actually get to decide the list of drugs from the insurance company. The insurance company gets to decide that. So if your doctor actually prescribes you a medication that isn't on the formulary, the first step would be talking with your doctor to see if there's an equivalent drug that is on the list. And if not, talking with your healthcare provider about how do you go through the process to ask your insurance company to make an exception so that you can actually take the drug that's being recommended by your doctor. There are also certain circumstances where you might be prescribed a drug that hasn't yet been approved by the FDA for the reason that you're taking the drug. And we call this off-label drug use. And it happens a lot in the cancer community where one drug has been shown to be very successful against one type of cancer, and that's been approved by the FDA, but it's also been shown to be successful at fighting other types of cancer, but that use hasn't been approved yet by the FDA. And so insurance companies often don't want to pay for prescription drugs that are off-label. But you can ask for an exception and go through the appeals process. And there's usually two levels of appeal. You go through the insurance company's internal appeals process until they agree to provide you with the medication. And if they are still not providing you with the medication, you can actually go through what's called independent or external medical review, where you get to go outside of your insurance company to ask your state insurance agency for assistance in getting approval for the treatment or the prescription drug that you need. And so you should contact your state insurance agency to figure out the process for independent or external medical review in your state. So there are also a number of patient financial assistance programs in the cancer community and in the healthcare community as a whole. And there are different types of programs that are offered through specific pharmaceutical companies and cancer advocacy organizations and other community-based organizations. And so you shouldn't assume that you don't qualify for financial assistance, because many of these programs might be available even if you don't have a low income, even if you have prescription coverage through your insurance company, and it may just be available if you can't afford your copays for your prescription drugs. So this next slide actually shows some of the patient assistance programs that are available. So there's organizations called Needy Meds, the Patient Access Network Foundation, Cancer Care, the Healthwell Foundation, and the Patient Advocate Foundation all provide various forms of financial assistance for individuals who are needing help paying for their prescription drugs, and sometimes other types of financial expenses. So we also just wanted to touch very briefly on different forms of disability insurance. Disability insurance is really a replacement for your wages, meaning that you aren't able to continue working for a period of time because of a medical condition. And there's short-term disability insurance benefits and there's long-term disability benefits. So short-term plans usually last 6 months to a year, whereas long-term disability plans are really for individuals who have a disability that's expected to last longer than a year. And you can purchase disability insurance directly from an insurance company as an individual, or it may be available to you through your employer as an employee benefit. So they may offer you a policy. And then some states offer short-term disability insurance coverage, and there's also 2 federal long-term disability programs, and that's Social Security Disability Insurance, or SSDI, or Supplemental Security Income, which is SSI. And both of these programs have different requirements, but if you wanted information about them, you could go to the Social Security Administration's website, which is ssa.gov, or you could call them at 800-772-1213. And certainly when we're talking about finances, the issue of ensuring that you've made decisions about not only your health care, but your finances if anything were to happen to you. And so there's a number of different types of documents that you should be aware of. And the first is called an Advanced Health Care Directive. And these are called different things in different states. So everything related to financial planning and estate planning is based on state law. So you want to look at what information is available specifically in your state. But generally, they're called Advanced Healthcare Directives, and they have 2 parts. So the first part is often called a living will. And a living will is a document that you can complete that gives your doctor information about what you want to happen with your medical care if you weren't able to make the decisions for yourself. So if you were in a car accident and you were unconscious, you would want to be able to give doctors instructions about what you wanted for your medical care, which is different than a power of attorney for health care decisions. So instead of actually writing out how you'd like your medical care to be taken care of by your doctors, you can just appoint someone else that you trust to make those decisions for you if you weren't able to make them for yourself. So a spouse or a friend or a family member or anyone whom you trust to make those decisions. So both of those elements are part of an Advanced Healthcare Directive. But then there's also something called a Do Not Resuscitate Order, or DNR. And this is instructions to your doctors that if you don't want heroic measures to be taken if you have a cardiac or respiratory arrest. You don't want any further medical care. And then specifically to finances, in addition to a health care power of attorney, there's something called a financial power of attorney. And this is someone that you trust that you're naming to make financial decisions for you if you're not able to make them for yourself. So if you were in that hospital room and you were still unconscious, and you weren't able to make decisions for yourself financially, you would have appointed someone who could actually access your bank accounts and pay your rent for you while you were in the hospital. So it can be something as simple as that. And then certainly wills and trusts are different types of legal documents that allow us to define what we want to have happen with our property and our assets and our money and any of other personal possessions, as well as identifying who would care for our minor children if we were to pass away. So wills can often include guardianship provisions as well. So really the point of this section is that if you have strong beliefs or ideas about what you want to happen in certain situations, if you weren't able to make the decisions for yourself at that time, then you need to put it in writing. So that's the bottom line. Anything that you care about, that you want people to understand what your wishes are, you need to put in writing. So so that those wishes can be carried out. So at this point, I'm going to turn it back over to Melissa.
Okay, great. Thank you, Joanna. So in talking about emotional concerns, an NPN diagnosis affects the way you think, feel, and act. And I think, knowing that this could be a chronic condition, those things change over time, and you kind of learn to adapt and cope. But we thought it would be helpful to provide some guidance here in talking about the emotional concerns and the things that you may be feeling. So just as you take care of your body, you must also take care of your emotions. And I know firsthand working for a cancer support community how important that is and how valuable I think it is for people to be able to share their emotions and to talk about, what's going on with their feelings and to know that they're not alone in that. So some of the emotional concerns and emotions, the actual emotions that you may experience. Anxiety, I think obviously getting anxious about not knowing what's ahead. And again, we're talking about financial concerns today. So, that can cause a lot of anxiety about, just as Joanna mentioned, you can have insurance and still have a lot of expenses and other things that you have to cover. So, hopefully some of the tips that we're going to provide today will help you if you are feeling some of these emotions around your cancer diagnosis and the financial aspects of it. Depression, anger, irritability, fear, grief, and loss. And I think this comes as a surprise to some people, but it's just that loss of your normal life. Things are different, and you have to learn sort of, what's the new normal and what can I expect in my life now. Helplessness and frustration are obviously part of that too. And I think, a lot of times having people around you and a support network helps you deal with some of these emotions, but we have to be able to want to talk to them about our concerns. So if we keep all that in, we can feel frustrated and alone, and we want you to realize that you're not alone in what you're feeling. Other things you may experience, loss of control, just kind of that sense of, the doctors are doing things to you, the healthcare team, and that you have no control over what's going on. Loss of hope, maybe you feel like there's no future or, your life is just all about the cancer. And uncertainty about the future, that's a big one. We talk a lot about in our support groups that emotional roller coaster. Every day is different. You get good news and you're on a high, and then you get bad news and you're down again in the valley. So, just being able to cope with that uncertainty and living in the moment is so important. And loneliness, I think again it's reaching out to people and it's asking for help, and it's I see people who are the main caregiver in their family, and so then when they're faced with a cancer diagnosis themselves, it's often hard to ask for help or to just reach out to people and not feel so alone in what you're going through. So some helpful tips maybe to manage some of those emotions. Educating yourself. I think that's probably the number one thing that you're faced with, when you hear the words that you have a cancer diagnosis. And so, learning what you can about your specific diagnosis and the treatment options can kind of help with some of that uncertainty of, what's next, what do I expect. Making a plan. I think it's really important to talk to your family and friends or others that can help you plan for what's to come. Just, again, that helps with that uncertainty. And if you can sit down and, people can even come up with lists of who's going to help with what kind of tasks, whether it's picking the kids up from school or, getting the groceries or who's, cooking for that week or that you have treatment or whatever it is. So any way that you can plan as much of it as you can, I think helps with the uncertainty and not knowing what to expect and what's going to happen next. And some things that I found helpful in my own life, but in others here at Gilda's Club that I've worked with, are finding, creative outlets or stress reduction types of things. And meditation is a good one, and a lot of people are intimidated by that, and there's lots of resources in terms of meditation tapes and CDs and things on the internet. Journaling. I was just reading a woman's book this morning who she journaled through her story, and she had never journaled before until she was faced with a cancer diagnosis, and how healing that was for her. So there's so many different things that you can kind of experiment with and see what works for you during this time. As I mentioned, asking for help. It's okay to reach out to other people, and you just know at some point you'll be able to help others again. But, if there's some specific things that you need, maybe even making a list of some things and having that available should people ask you, because they will ask. They will want to know how they can help. Finding a support group, whether it's at a cancer support community or a Gilda's Club or an online support group, there's lots of resources in terms of finding other people that you can talk to about it who understand what you're going through. And expressing your feelings, again, I think keeping things bottled up and inside just adds to that frustration, that fear, and all the things that are, the loneliness that are going on. And so the more that you can talk about what you're feeling and be around other people who are experiencing what you're experiencing, I think is helpful. So here's a quote from Dorothy, a myelofibrosis patient, on the importance of communication. One thing I found is that it helps me to talk about my diagnosis, especially when family and friends take the time to ask and try to understand this disease. Knowing that people care and want to know what I'm going through gives me strength and hope. So just a really good quote there about just the importance of talking to other people. And we found that research actually shows that cancer survivors have a hard time communicating with their healthcare team. I think it's just such an overwhelming time, and going into appointments, you may feel anxious about that, and so you're not communicating maybe really what's going on or your needs, or you're not sure who to ask or what to ask. So I think some tips to maybe help you improve that communication with your team is to prepare your appointments. And there's a number of ways you can do this. We actually have a service through the cancer support called Open to Options, and this can be done at a local affiliate, and it can also be done over the phone via our toll-free line that I have a number that we've provided at the end of the presentation, where you actually sit or talk with someone and develop a written list of questions for your doctor's appointment. So if you're struggling with a treatment decision, this is a really helpful way, I think, to kind of organize your thoughts around, what are the questions that you need to ask, and then you actually get a written list that you can take with you, or it can be faxed to the office ahead of time. And so whether you do something like Open to Options, just I think writing your questions down and the concerns you have, this can be a journal type thing or a medical journal, healthcare journal, anything where, in between appointments and things, writing those things down, because we all get into the office and, it's like deer in the headlights and you forget, the one question that you want to ask. So I think if you have them written down, that's going to help you to remember. And then asking someone to go with you. It's nice to have that support of someone, and people will say to me, well, I don't need anybody to go with me to my appointment. Well, it's really important, because I think not only can they just be another listening ear to understand and comprehend what the doctor is saying, but they could take notes for you while you focus on, the conversation and the things that you really want to talk to your doctor about. And starting a journal. Again, you can have a journal for your emotions and things that are going on, but you can also have a healthcare journal where you're keeping track of medications and side effects and those things that you're experiencing, so that you can remember when you go to your appointments what's been happening since the last appointment. And definitely, I'm sure this probably seems obvious to a lot of people, but asking for clarification if you don't understand. And, I find that the oncology nurses are just a really good resource for that, too. And if they don't know the answer, they can talk to the physician and get that clarification for you and be the go-between. Knowing who is a part of your healthcare team, there's so many people that make up the team. And so not only knowing who they are, get their business cards and carry those in your journal, so who is the nurse navigator at the hospital or the cancer center that you can talk to, or, what's the name of that social worker should you have something come up and you need to reach out to that person. And you don't have to do this in a time of crisis. You have that information available and what each of their roles are. So a little bit about positivity and just sort of emotionally how we cope with cancer and difficult things that happen to us. Being positive does not mean that you don't feel negative emotions. And, we get that a lot here. I think at Gilda's Club, too, people that hesitate even reaching out to us because they think it's a depressing place to go. And it's really not about that. It's about being able to be around other people who understand what you're going through and expressing those emotions and concerns. So again, it's not that you don't have days where you feel down, because we know that you're going to have those. But, we want you to balance that optimism with the hope and the realistic understanding of the diagnosis. Is this a chronic thing? Is this something that you're going to be dealing with long term? Or is it more acute, where you have a lot of changes in your treatment plan? And then finding the new normal, again, we talked about that, which, if you're not able to work for a period of time, that's your new normal. And so what do you do with your time? And just figuring all that out and making your family and those around you understand what this means for you. So hope can mean many things. It can be peace in relationships. It could be open communications with doctors. There could be a lengthy period of time between appointments, and so, it's trying to figure out that balance again of when to call the doctor and when something concerns you. Is this something that I should alert somebody to, or do I just kind of wait and see? But, if you just kind of sit back and you think, oh, I don't want to bother anybody, again, I've heard from lots of physicians and healthcare personnel that say, we definitely want you to let us know. That's what we're here for. So keeping that communication open, I think, lends itself to your hopefulness. Maintaining good physical and emotional health. We've talked a lot about emotions, and so a part of that really is your physical abilities and staying active and trying to, get in some walking or light exercise. And there's all kinds of great programs at the Cancer Support Community and Gilda's Club and Live Strong at the Y and things in your community. So if you need to reach out and find some resources for cancer survivors in terms of your physical abilities and fitness, I would encourage you to do that. And then just coming to terms with the cancer and the fact that it could be more chronic than acute types of situations. And so that means, long term, what does this mean for me over the course of, a long period of time, years, months, and what kind of changes, should I expect over that long term. So here are some resources that we've got listed. I did mention the Open to Options program, the number there that you can call, the Cancer Experience Registry, which is a very valuable resource available that's through the Cancer Support Community. I would encourage you all to go to the website and check that out if you don't know anything about that. The Cancer Support Helpline. We've got online support groups, and then just our affiliate network of all our programs and resources that are available at no charge. And I'm sure many of you are aware of these resources for MPN information and support, which are great. I've learned a lot by checking out all of these resources. And so I won't go through them all because I'm pretty sure most of you are aware of those resources that are available. Okay, so now we've come to our question and answer time. And I believe you can just look to the right of your screen there. There's a little question and answer box where you can type in your questions.
Great. Thank you. Thank you, Melissa.
Mm-hmm.
Thank you, Joanna. So as Melissa said, we will be conducting our Q&A session. So you can go ahead and type your question on the Q&A box to the right. We'll take a few moments and gather some of your questions. Okay, so our first question is for Joanna. How much does it cost to participate in a clinical trial?
So there's a couple parts of an answer to that question. So the cost that it is to participate in a clinical trial really depends on the clinical trial that you're participating in and currently the state that you live in. Because when you participate in a clinical trial, the routine costs of your medical care, like your office visits and any lab tests or blood work that you'd be receiving, can sometimes be denied by your health insurance company. Now, about half the states have state laws that say that insurance companies have to cover the routine costs when you decide to participate in a clinical trial. And so that covers just about anything except the actual procedure or test or drug being tested. And usually those are covered by the pharmaceutical company that's testing that drug or treatment or whatever it might be. The Affordable Care Act actually changes this starting January 1st of next year and makes it federal law so that insurance companies have to cover the routine costs of participating in a clinical trial for everyone.
Okay, great. Thanks, Joanna. Melissa, we have a question for you. My spouse is unwilling to openly discuss the diagnosis. How can I make them more comfortable about sharing what he or she is going through?
Okay, well, that's a really good question and one that I hear a lot, actually. You know, it can be difficult because we can't make anybody talk to us about what they're going through, obviously. So I think, you know, I've seen a lot of people who they just kind of focus on their emotions and what they're going through as a person with the diagnosis. And then, you know, finding opportunities maybe to talk about things. But, you know, your spouse or, you know, your other family members may not know how to get the conversation started. So looking for those opportunities. But they also may not, you know, verbally communicate very well about their emotions just in general. And so, you know, you can always provide resources to them in terms of things that they could seek out for their emotional well-being. At Gilda's Club specifically, we do have support groups for family members for that instance because I think sometimes family members don't want to talk to their spouse or the person with cancer about what they're going through. They don't want to put that pressure on them or burden them. And so if they can find their own outlets, and so, you know, I just think you do the best you can with trying to talk to them or just get a sense of how you think they're doing, maybe providing some resources and kind of letting it see what happens. You know, even if you have a friend who has a cancer diagnosis with a spouse that, you know, maybe they could reach out to that person and connect with. But again, it just goes back, you know, we all have to kind of take care of ourselves first and then, you know, do the best we can with our family members and wherever they're at with it.
Great. Thanks, Melissa.
Mm-hmm.
Our next question is also, actually this is for Joanna. Where can I get help with estate planning and legal issues, such as writing my will or granting a power of attorney?
So to get information about estate planning issues, there's actually a few different places that you can go. If you want information about advanced healthcare directive forms, there is a website called caringconnections.org that has all of the forms for each state. So you can go directly there and find out information. If you're looking for legal assistance to help you fill out the forms, which isn't always necessary, but if you feel like you need the assistance, you can go to a website called lawhelp.org, and that organization has information about your local legal services programs, and then certainly you can always find a local attorney to you through your certified state or county bar association. And when you call up the bar association, you're going to ask for referrals to estate planning attorneys in your area. And usually they give you 1 to 3 names of attorneys that you can call and set up consultations with.
Okay, great. Melissa, we have a question for you. How should I approach speaking to my loved ones about my needs?
Well, I think one thing is just to find a good time to, bring the family together. It kind of depends on the situation, I guess. If there's kids involved, younger kids, then, we always kind of suggest the parents talk amongst themselves about how they're going to address it with the kids. If it's adult family members, I've seen family-type meetings where everybody gets together and kind of talks about the situation and what's going on. There are online resources even like Caring Bridge. It is a free website available for people who you can set up kind of your own page, and then you keep your loved ones updated. You basically journal, and only the people that you allow can see that, and they can log on and see your progress, and that's helpful for communication with the families, especially when there's a lot of extended families and families living apart from one another. That's a good way to communicate. So there's lots of resources out there, and I would suggest reaching out to the cancer support community about, the best way to kind of handle talking to the family and communicating your needs to them.
Okay, great. We have time for only one more question. Joanna, my mom is in a clinical trial right now. Travel costs are the biggest cost. There's a small reimbursement. Copays are not covered, and blood tests run through insurance. Are copays covered in the new law?
So that's kind of it's a general question. So the new law doesn't require that insurance companies provide you with all care without a copay, just specific preventive services. And so a clinical trial wouldn't count as a preventive service. So you would still be responsible for any copays associated with getting medical care, whether or not you're in standard care or in clinical trial. But there are financial assistance programs out there to help you with your copays. There's also a number of organizations that provide assistance with travel costs, whether it be ground or air transportation, and sometimes with lodging costs as well. So I would suggest that you look at the National Cancer Institute's website, which is cancer.gov, G-O-V, and search for their financial assistance section, and they have a page with resources of different types of areas of financial assistance.
Okay, great. Thank you. So thank you all so much for your enthusiasm and questions that have contributed to making today's webinar a great success. If you'd like more information on myeloproliferative neoplasms, please visit our website or call CSC's toll-free line at 1-888-793-9355. Again, we would like to thank our wonderful speakers, Joanna Morales and Melissa Wright, for contributing their time and sharing this important information with us. We'd also like to thank our sponsor for today's webinar, Incyte, and please take a moment to complete our post-event online survey, which you will be redirected to. We greatly appreciate any feedback that you may have. Thank you.